All right. Hello, everybody. Thank you so much for joining us tonight. I'm so excited to introduce Dr. Courtney Hays. Dr. Hays and I have known each other. I was trying to think about how many years it's been. I don't even remember. Probably at least 10.
5 to 7, I
Oh,
would
it's
say.
no, maybe almost 10, right? Because we met when I was in Costa Mesa,
Mhm.
which has been a while. So maybe more like 7 or 8, but I feel like we've known each other forever. But just some background on Dr. Hayes. She was born and raised in Calgary, Alberta, Canada, where she trained as a competitive dancer, performing in all styles, including tap, jazz, ballet, and lyrical. And her passion for movement led her to California, where she graduated cum laude from Palmer College of Chiropractic in San Jose. And during this time, she served as the Sports Council president, attending weekend sporting events to provide sports chiropractic care to a wide variety of athletes. And upon graduation, she received the Clinical Excellence Award for exceptional proficiency and has been practicing in the Orange County area ever since. Dr. Courtney has extensive postgraduate training in soft tissue work, prenatal chiropractic care, postpartum rehabilitation, and sports workout injuries. And her certifications include Webster Technique, full body active release technique, dynamic neuromuscular stabilization, and upper and lower quarter clinical neurodynamics. By combining this variety of training, she has a very unique approach to chiropractic care. She prides herself on being exceptionally thorough with her patients with diagnosis and treatment, and she implements many checks and balances to ensure the individualized treatment protocol is effective and while always keeping her patients' goals in mind. And after becoming a mother in 2021 and again in 2024, her passion for perinatal chiropractic care deepened as she experienced her own challenges during the prenatal and postpartum phase. She feels so honored to be able to walk alongside her patients during this transformative season of life. And so I've had the pleasure of working with Dr. Hayes for several years now, and I just can't tell you what a pleasure it's been to work with you, co-manage and co-treat patients. I've had many patients tell me that they have been to a handful of chiropractors, but you have been the best chiropractor they've ever seen, especially with rehabilitation, postpartum care, and pregnancy support. So thank you, Dr. Hayes, for being such an incredible healer and practitioner and just really adding so much value to the practice. So, but I wanted to kind of start off by asking you how you got started with chiropractic care and, what was the process for you? How did you find chiropractic care to begin with?
Yeah, well, first of all, thank you so much. It's an honor to work with you too and, be in this space. I found chiropractic care actually through my mom. So she introduced me when I was a child. And then as I started becoming more and more competitive with dance, had knee pain and back pain and, injuries here and there. And so that's when I really sought out a sports chiropractor. And that chiropractor is who really like motivated me to pursue this as a career. And so he worked with dancers specifically. And so that was always kind of my what I had my eye on. Like I really wanted to work with athletes, people who were active, people who were moving, and just had like performance goals. And so when I went to Palmer, I picked that school partially because they had a very large sports council, which allowed me and my other classmates a lot of hands-on opportunities while we were still students, working at marathons, working at rugby events, working at all these variety of different things. So that was kind of how I got my start and how I got into it. And then as my career has progressed over the last like 8, 9 years, this whole working with women and women's health and pregnancy and postpartum, it honestly just fell into my lap. Like it was not an intention. It just kind of happened over time and it just felt so right. It just felt like
Mhm.
it was where my calling was to really help women in this phase of life where there's often a lot of misconceptions. There's a lot of pain that's normalized.
Right,
There's a
right.
lack of care in the Western medical system for a lot of issues that pregnant women experience in postpartum. And so I really started to realize like everybody wants to work with athletes. Like athletes have people banging down their door trying to get them, to work with them. But moms are really in need, and of course like my own personal experience really tied into that, and feeling like the people that really held me and supported me during those periods were my chiropractor, my acupuncturist, massage
Mhm.
therapist, just all these people who have dedicated their lives work to helping women. And so I've just kind of continued that. And the only men that I treat currently are husbands of my patients. So those are really the only men that I'm interacting with in a professional setting, because it's just
Wow.
been so women focused, and I love it.
Sure. That's so interesting. But, I think the common thread is that your mission is to help people move freely and better without pain, whether you're an
Yeah.
athlete, a mom, a dad, like that, that's just the main goal. And it's so important. And
Yeah, and
I do,
that's what's different about, like, what I have people tell me is that my approach to chiropractic differs because of the movement rehab component to it. So instead of, just doing the same adjustments on the same areas week after week after week and getting
right.
temporary relief, there's much more you can do to dig deeper and figure out, why is that area constantly tight? Why is that area always need to be adjusted? And then
Mhm.
there's other ways of healing the body that way, as opposed to just kind of band-aiding the regions of pain.
Absolutely. And I think that that model fits so well into our practice because we're so focused on treating the root cause,
Mhm.
not just
Absolutely.
symptoms, but the root and the branch. So I know for a lot of the patients that we see, since we're primarily a women's health clinic and focusing a lot on fertility, I think when patients are working on fertility and they're focused on getting pregnant, the next phase, it's like you don't realize all the different phases, right? So they're pregnant, they're kind of, really cautious in the first trimester as far as what they're able to do. And then as soon as they pass the first trimester and get into the second trimester, they're like, okay, what can I do now? So chiropractic care is like at the top of my list. Like, okay, you got to get ahead of it because we want to make sure that you have a smooth labor delivery and fourth trimester and postpartum recovery. It's so important.
Yeah, it's all very interconnected. Like, the things that you do in the first trimester will influence the second trimester, will influence the postpartum rehabilitation. So I feel like that's one of the biggest things that I would love people to know, is that the sooner you can have work done on your body as it's growing and evolving and the physiology is changing, the better your outcomes are going to be. Because if we can find and address something, at week 10, and as opposed to at week 35, where baby's much bigger, taking up a lot
Right.
of space. There's just so much that can be done so early on that can influence the outcomes later on. And so I think that's a big, like, misnomer.
I think that's a really good point. The sooner the better. And, I think I ask you about timing all the time, but now you've educated all of us, so we are aware
Yeah.
to refer patients earlier. So a big part of your practice is Webster technique, or
Mhm.
you use a lot of Webster technique in your practice. Would you be able to tell us a little bit about Webster technique and what it involves?
Yeah. So, Webster Technique is a specific chiropractic analysis and adjustment that is designed to balance the pelvic muscles, bones, and ligaments, to optimize the pregnant mother's pelvis during pregnancy and birth. So, the technique was developed by a chiropractor who was working alongside an OBGYN. And whenever the OBGYN would have patients with breech babies, he would send them to this Dr. Webster to have their sacrum adjusted and some of the other structures on either side of the back of the pelvis and the front of the pelvis. And what he started noticing was this correlation of, like, correlation is probably not the right word, but this association that for many of these women, once they had their pelvis adjusted and there was there was more symmetry side to side, that babies were turning to head down and they were able to have a vaginal birth. So that's how it kind of started. And then it became a certifiable technique that you can train in when you're, even as soon as when you're in school as a chiropractic student. And then they've just kind of expanded from there. So
That's
that's the
amazing.
basis of the technique.
Now that sounds amazing. So as far as Webster technique versus traditional chiropractic
Mhm.
adjustments, how do they differ? And what's the difference
So
between those two?
yeah, it's a good question. So the Webster Technique actually does incorporate some like quote unquote regular chiropractic adjustments in it. However, the adjustments are just performed a little differently to adapt for the belly and to adapt for the physiological changes during pregnancy, such as like ligament laxity or just discomfort in general. So, as an example, like many people who've been to the chiropractor have probably had their lower back or their sacrum area adjusted before. And a very common way to do that is kind of lying on your side, twisted, kind of like a pretzel, and then have the chiropractor kind of drop down and do the adjustment on that area. So in the Webster technique, it's recommended to do that adjustment a little differently, just to have a little bit less force on the spine. And so we perform that with what's called a drop table. So the table will actually kind of pop up and then we'll push down. It makes like a loud thunking noise, so it sounds a lot more scary than it actually is. I'm sure you can hear it outside the room sometimes, like what is that banging noise? But it's actually a lower force way of adjusting the sacrum, which is recommended during pregnancy. So essentially, we can adjust many of the areas similarly, but then some of the areas we just have to kind of adapt it for the pregnant body.
And I'm sure it depends on what stage of the pregnancy they're in too.
Absolutely. And of course, like we're still taking an in-depth history. We're still talking all about previous injuries, we're getting to talk about all those details to make sure that it is still safe and it is going to be okay to do certain adjustments during pregnancy. And if there's any contraindications, we also have like handheld tools that can help do some like lighter adjustments. So it really just depends on the person, but there's a lot of overlap.
It's nice to have options too.
Yeah, yeah.
So this is probably a question you get all the time. So is the Webster technique only for breech pregnancies?
No. So the Webster technique can help with breech presentation of a baby,
Mhm.
but it also is very effective managing the aches and pains of pregnancy, whether it's just, low back pain, whether it is more severe into the sciatic type of presentation, going down into the glute or the leg, or even just like pain in the front of the pubic bone. So it can be used for both. I know we'll probably get into a little bit more of the details of what that means and how we work with breech baby
Sure.
presentation, but it's not just for that. It's for other aches and pains as well.
Okay, great. Thanks for clarifying that because I do get that question often.
Yeah.
So as far as optimal fetal positioning for like breech pregnancies and transverse pregnancies, how exactly does Webster technique work?
Yeah. So to answer that, I'd like to go over a little bit about the anatomy of the female pelvis. And so many women don't really know that there's ligaments that actually connect your uterus to your sacrum, which is that kind of triangular bone at the base of your lower back. There's a ligament that goes from the uterus to the sacrum. And then there's other ligaments on the front of the uterus that go all the way down into the soft tissues of the front of the pelvis. And so this is significant during pregnancy because as the uterus is expanding, there's going to be a lot more tension and a lot more pull on those ligaments. And so, as you can imagine, if maybe one side is tighter than the other side, that may inhibit or change the way that the uterus grows as the baby is growing. And so we want the baby to have as much room and as much flexibility as possible in the uterus to be able to move around naturally and find its way eventually head down for delivery. So we we want to the Webster technique is going to help to balance all of those structures.
Mm.
That's what it was developed to do. And so by doing that, it encourages the baby to be able to kind of innately move into the position that it needs to be in. So it doesn't always work to help the baby find its best position. I mean, nothing's for sure, but it at least is allowing the baby more space and hoping that unless there's something anatomical in the way that may be preventing that baby from moving into the best position possible, we're trying to clear those things out. So another analogy I like to give is imagine you're trying to get your foot out of your running shoes and your laces are still really tight.
Mhm.
It's going to be challenging to get your foot out of your shoe, right? But if you're able to loosen your laces and kind of go level by level and loosen those up, then you're going to be able to slide your foot out of your shoe more easily. So I kind of envision those laces as those ligaments that I was describing. And by loosening those ligaments, we're able to allow for better movement.
I love that analogy. I'm going to use that for now.
Yeah, yeah.
It makes a lot of sense though. I think that because there's so much growth and development in pregnancy and
Mhm.
and babies need the space to be able to move around.
Yes,
So
yes. And so that's why what I was kind of saying earlier of like the sooner that you can get your body looked at, the better is for that reason because the babies grow fast,
sure do.
the days feel long when you're nauseous and pregnant and feeling
Right.
uncomfortable, but it goes by fast. And so if we can have that symmetrical tension or as symmetrical as possible tension throughout the pregnancy, then the hope is that the outcomes at the end are going to be that much better.
Mhm. Well, this kind of leads into another question. What is the ideal timing? If you had your choice, when would be the best time to start
To
treatments?
start it, I would say like end of first trimester, beginning of second trimester. That's usually the best time to start. And depending on the evaluation of this patient's particular body, it will give me an idea of how frequently a Webster treatment and adjustment would be necessary.
Okay, so in
So,
the 12 to 13 week window.
yeah,
Okay,
that
so
would be it, that would be in a perfect world.
in the perfect world.
Yeah.
And now here's the other side of the question would be what's the latest for a patient to come in where you feel like it's effective
I
to
mean, I've had patients come in at 38 and a half weeks and be like, this baby's head up, help me get this baby head down. And
right.
they turn.
Yes.
But that's not always the case. So it's really specific to each person's body, to the baby's position, to the quantity of amniotic fluid, like all these things. So
Sure.
um it's hard for me to say.
Yeah, well, I love the collaboration that we have when we have either breech or transverse pregnancies, and patients are calling in and they're like 36 weeks,
Yeah.
and they're like, please help me because I want to have a vaginal birth. And so, we've had the benefit of being able to work with you because in acupuncture, we usually do acupuncture with moxibustion therapy, which is great too. And it helps to kind of relax the uterus so that the baby can more easily move. But I think now that we're able to co-treat with you and you're providing this amazing Webster technique, I feel like the success rate of optimal positioning has been much higher in our
Yeah, it's like all hands on deck. Most patients
for sure.
call and we're like, how much time do you have?
Yes, and they're like, "Yes." I mean, I've had patients come in, see me for acupuncture, and they're like seeing you that afternoon
Yeah,
because 'cause they're so motivated, right, to
yeah.
get this baby in
I
the
love
the
that.
right
Yeah.
position. So besides the breach aspect, what are some of the other things that you have noticed that Webster technique can be really beneficial for? Like, is it helpful for reducing labor pain or the duration of labor?
So I would say yes, all of the above. So I've seen people with really crippling back pain, sciatica. I once had a patient that actually was rolled into the clinic. She couldn't even walk and she was pregnant. And, her PT, her orthopedic spine doctor, no one had anything to offer her because,
Mhm.
it was so severe. But I was able to help her with some adjustments and work through the Webster technique. Um, but yeah, I forgot what your question was.
Oh, it was just about if it can help reduce labor pain.
Oh, labor time. Oh, yes.
Yes, and
Yes.
duration of labor.
So, absolutely. So I would say that once again, related to the baby's positioning, if
Mhm,
baby is lined up as optimally as possible with the head really pushing on the cervix, and kind of like everyone likes to say, like lined up in the birth canal is like everybody loves to say that. It can definitely decrease the length of labor. It can decrease the pain of labor,
mhm,
because the more the head is lined up with the cervix, the better the uterus can contract to push the baby out.
right.
And the less that you have to do during labor to try to get the baby into that position. Um, I can definitely attest to this with my two pregnancies. My first pregnancy, I was the worst patient. I got adjusted maybe a handful of times, not by a Webster doctor.
Mhm.
And I had an exceptionally long and rigorous, laborious labor. My daughter was asynclitic with her head tilted, trying to get pushed out.
Oh,
And so that was a very, very long and exhausting experience. So
mhm.
the second time around, I was a very good patient and I got weekly Webster adjustments.
Nice.
And the length of my labor decreased by like a fifth. Like it was much faster, much smoother. I mean, obviously it was also second baby, so there's usually a component to that too, but um it helped me immensely to be able
Oh,
to have a much more smooth labor and much happier baby on the other side of it too. I will
sure.
say. Yeah.
That's incredible. Well, so it sounds like every pregnant woman can benefit from Webster
Yes.
technique adjustments.
Yes.
I think you already answered this, but just to double check, it's a safe treatment for all the trimesters, like
Yeah.
even Mhm,
So I would say like yes, it is. But it's also important that the pregnant person feels comfortable with what they're doing. So that's
mhm,
why I always, recommend that if you're feeling uncomfortable with the idea of getting an adjustment at a certain point in your pregnancy, then first of all, if you have any questions, ask the chiropractor, ask them, air out your concerns or your questions. But also just wait until you feel comfortable, wait until you feel ready, because that's really what's most important at the end of the day.
for sure.
Yeah.
Definitely. So now there's so many positive things about this type of treatment. Are there any risks or any cautions to
I
deal with?
mean, yes, like with any type of body work or hands-on work, there's the risk of soreness, there's the risk of bruising. Like I was mentioning earlier, the Webster adjustments are designed to be less forceful, and a lighter pressure on some of the other ligaments that we're working on. So in my practice, I don't find there to be very many adverse reactions to it. But like anything, a massage, PT, any of those things, there are inherent, risks of doing that. And so
Sure.
being educated and informed and knowing if you're comfortable with that is really important.
Okay, that makes a lot of sense. And how many treatments does it usually take for patients to start seeing results from the
Results.
treatment?
It really depends. If I have somebody come in who has had severe pain for a couple of months during their pregnancy, then we're usually going to take a couple weeks to start to see some noticeable change. Um, Other times, like I just had a transverse baby last week,
Hmm?
flipped the next day to head down.
Cool.
Um,
Awesome.
so that's always a win, that was
Sure.
at 35 weeks.
Okay.
So it's so dependent. Like, I mean, I've had people get off the table. Like I was describing the lady that got rolled in on a chair. She walked out of the office. So it really just depends. But I do tend to see some really amazing things
Nice. So
with after treatment.
yeah, so it's case by case, but it
Case
sounds
by
like
case.
it's pretty quick
It
to
is,
see
yeah. And I will
results.
say for myself, when I was getting adjusted during pregnancy, I always felt a little sore for the rest of that day.
Mhm.
But then whatever it was that was bothering me would be gone by the next day. Like when I'd wake up, I'd be like, okay, I feel so much better today.
Yes. Yeah,
So
it's
for
worth
me,
it
yeah,
to
I
be
had
a little
that like,
sore.
yeah, I had that like initial soreness afterwards,
Mhm.
getting up and just kind of like moving again as your body's kind of reorientating with this new joint positioning and tension in your body. But then by the next day, I would always feel an improvement. So
Right,
yeah,
nice.
case by
Okay.
case.
So, as far as I know, these are probably the common things you see in pregnancy because this is the same things that we see, especially in the second and third trimester. And I would imagine Webster technique is helpful too for like pelvic pain, sciatica, and round ligament pain. Is there anything else that you commonly treat in pregnancy
During
that comes up?
pregnancy,
Mhm.
um, recently, I've been having a lot of thoracic outlet syndrome. So people with numbness and tingling into their hands during
Mhm.
pregnancy. So that can present as like wrist pain, tingling into your fingers, swelling into the upper body. So that's another thing that's not commonly talked about is
Sure.
especially, towards the end of the pregnancy,
Mhm.
having some of those nerve symptoms from the shoulders down into the hands.
That's so interesting. I bet it's misdiagnosed a lot as like
Yeah,
carpal tunnel syndrome or
it is. And I've
can't
been
hear.
finding too that um if they've received treatment on those areas before, they've had like localized treatment to, let's say, the scalene muscles or the wrists and the hands. But what's been forgotten is the thoracic spine, which is the area between your shoulder blades. And when you're pregnant, especially that lower thoracic spine, there's a lot of pressure on that area because of the change of your center of gravity. With
Sure.
your belly going forward, something in
Right.
the back of your body has to tighten up to kind of be able to manage.
Compensate.
Yeah, be able to
Yeah.
manage that weight,
Right,
and just a
right.
growing baby in the front, and so, that's been something else I've been seeing a lot more frequently recently, especially some of the hand symptoms if the person has a toddler at home,
Mhm.
or other children, they're lifting,
Mhm.
can be really strenuous, but I would say the most common thing is definitely lower back pain.
Okay.
Yeah,
Well,
and that's something that I wish everybody knew was
yeah.
you know, lower back pain is common during pregnancy, but it's not normal. You should not have to suffer with lower back pain when you're pregnant. There is so many different modalities and things that you can try. Um, whether it's Webster Technique, whether it's acupuncture, cupping, pelvic floor PT, like we obviously have a very collaborative approach with how we work with our patients. But I just would like people to know they don't have to suffer with that pain and you shouldn't have to brush it off or just think that it's just normal. I'm just going to battle through this and
Right,
hope for
right.
the
That
best.
that this is just part of the 3rd trimester.
Yeah. And I just hear it all the time from so many of my patients saying, like, oh, yeah, I mentioned it to my OB. And they
Uh,
just were like, yeah, it's just kind of part of the gig being pregnant,
right.
and, or they're
There's a lot of
recommending.
dismissal of it, right? Like,
Yeah, completely. Or they're recommending like Tylenol for management of that pain. And, of course, we want to limit that as
right,
much as
right.
possible when you're pregnant. So having holistic alternatives such as chiropractic, Webster Technique adjustments, soft tissue work, these things are all so helpful to be able to manage that when you're pregnant.
Well, I just think that every pregnant woman needs to have a chiropractor. I am
Yeah.
convinced now, just all of just the things that you have mentioned with the Webster technique and how helpful it can be and,
Mhm.
and not really knowing that, it's an option to not have back pain or sciatica
Right.
in pregnancy.
Right.
I can't tell you how many of my patients are like, "Oh, yeah, I had it with every pregnancy." And it's just normal. Like, it
I
here
know that makes me sad.
yes,
Makes
I
me
hear
sad
it
that
all the time.
just shout it from the rooftops, it shouldn't be like that. Like women
Oh,
shouldn't have to suffer like that.
right, right. And just like postpartum,
Mhm.
having pelvic floor dysfunction or pelvic floor pain
Yes.
after birth in the 4th trimester. I mean, I had my son 22 years ago, and I remember my OBGYN saying, "Oh, don't worry, that's normal.
Right.
That's just part of being a mom." And
Yeah.
she didn't talk about pelvic floor therapy. She didn't talk about chiropractic care, nothing. That nothing was offered except, unfortunately, pain meds.
Right.
So I think a lot has changed though in 20 years, and I'm
It
so
is
grateful.
changing for sure.
Mhm.
For
So
sure.
grateful for that for our
Yeah.
patients. So speaking of postpartum recovery and 4th
Mhm.
trimester, what are some of the things that you've seen in your practice and how chiropractic care can really support this phase, and the recovery phase after
Yeah.
delivery?
I would say that the most common thing that I'm treating during the postpartum period is neck pain, shoulder pain, and like upper back pain between the shoulder blades.
Mhm.
I find that in many cases, when someone has had lower back pain or pelvic pain during pregnancy, in many cases it resolves after delivery.
Sure.
As soon as the baby's out of your belly, for a period of time up until activities start getting reintroduced. That's usually when it'll kind of be more prominent. But that neck pain, shoulder pain, headaches, that type of thing is the most common thing I see postpartum because you are holding your baby around the clock, feeding, looking at your baby,
Right, right.
putting them in a weird position, shoulders up, you're tilted to the side, you're trying to get the right pillows. Like it's very very challenging on your posture. And so being able to support women with different adjustments and soft tissue modalities for that area during the postpartum period is really beneficial.
And not to mention too that when your milk comes in, like your breast size changes too, so
Yes.
that definitely impacts your upper mid back.
Oh, absolutely. Absolutely. And then you're trying to find the right support with a bra, nursing bra, and
Yes,
you don't know what size it needs to be when you're pregnant. So you're
that's
just
right.
like
That's
trying all
right.
these different things and yeah,
But
yeah.
I'm glad to hear that oftentimes you see that the low back pain resolves, but unfortunately you're trading it in for more of the upper back
Yeah.
and
It
neck.
resolves temporarily and then I usually will see an uptick of that once exercise is reintroduced,
Mm,
or just even like longer periods of standing or walking, that type of a thing. Especially if somebody has not been seen by a pelvic floor physical therapist yet.
mm,
I They will come to me thinking that it's just their lower back that's the problem, but we're typically going to be discussing principles of core stabilization, breathing, and how that connects to being able to be protective and helpful for lower back issues.
right. That's so great. So there must be some specific or common exercises that you share with your patients after birth. Are
Yeah.
there any like stretches or specific exercises that you usually suggest for patients as a complement to your care?
hmm Definitely. So I would say the first and most common one would be diaphragmatic breathing, and how that is related to being able to create pressure through your core and tension through your core, to reconnect with that area, reestablish those neural pathways of those muscles that have been stretched and elongated and disconnected to for a while during pregnancy. So that's the first one for sure. And then the second area is thoracic mobility, so that your thoracic spine is between your shoulder blades. And regaining mobility and movement through that area is going to be very crucial.
Hmm,
So I would recommend for that area doing like cat cow type of stretching, making sure you're breathing when you're doing those movements so that you're not holding your breath and creating more tension through your body. And then another one I like is like a side lying twisting, an open book type of pose that you may be familiar with from yoga. So
mhm.
that's going to provide some rotation through the thoracic spine in order to get it moving nicely. And then as an added bonus, when you're in that side lying position, you're also getting a stretch through your pecs, which
Nice.
are very tight when you are holding your baby and feeding and
Right,
all that
right.
stuff. So I once had a patient tell me that their chiropractor told them just to not look at their baby as much to help with their neck pain.
Oh,
And I thought to myself, your chiropractor definitely doesn't have a child. Like that is the most horrific advice I've ever heard.
that's
Yeah, of course
yeah,
you're
I
gonna look at
that
your
that
baby.
seems that seems like it's just impossible.
No, it is impossible. And that should never be a recommendation for management of neck pain postpartum. So there are many other things that can be done.
Well, I'm
Like,
glad that there are so many like easy to do exercises that you can incorporate. And I would
yeah.
imagine like on a day-to-day basis would
Well,
be
I always say too, like if you're laying your baby down to practice some tummy time,
yeah.
go right next to them and do your cat cow so you can still have a
I
close
love that.
eye.
That's
You can still have a
yes.
close eye on the baby, or
Right.
if you're side lying with them in bed and they're asleep, like you can do one side of your rotational open book stretches.
Yeah.
Hopefully try to remember the other side later. So
Well,
it's really gentle movement. This is in like the early postpartum phase is what I'm describing. Gentle movements, nothing overly strenuous. You shouldn't be feeling pain when you're doing these. It should all be just, some a deep stretch or for the rotational one or the cat cows. Yeah.
but it's kind of cute too, because then you kind of have like mommy and baby time,
Yeah.
and
Go
it
through
can
your
progress.
exercises together.
Yeah, it could progress into something that you continue to do as they get older.
Yeah, yeah, absolutely.
I think that's awesome.
And then once you're starting to feel like, okay, maybe my lower back's starting to get a little bit sensitive or a little bit vulnerable, that's when we start to incorporate the breathing during a hinge, let's say. You're gonna
Mhm.
hinge and put your baby in the bassinet.
Yeah.
So these principles kind of build upon each other. not only just with like what we're working on hands on, but what we're talking about as recommendations for you to think about at home as part of your movement rehab and part of your recovery, really.
I love that because it's so practical and it's so applicable to your day-to-day
Yeah.
activity. You know,
Yeah.
what are the things that you're repeating over and over again, like putting your
Mhm.
baby in the crib and holding the nurse and s-
Yeah.
that's
And I
amazing.
usually like having being someone that's been through it a couple times now, I try to be mindful of like not being overwhelming for the mom because you're in those early months, like there's just so much that you're juggling and there's so much emotional, ups and downs. And I would never want to instill any like guilt or anything on someone if they're like, well, I just can't do those exercises right now. So I usually try to keep it very simple. And depending on how that person is doing that day, sometimes I'd even don't give them exercise homework on a certain visit because I can just tell that they're overwhelmed or tell that,
Sure.
they just need a little bit of TLC when they've come to
Yes.
this.
Right, right.
So I usually try to gauge it and I don't make it a stressful or overwhelming or yeah, I just want to meet them where they are and I want to be able to support them how they need and not make them feel bad if they didn't have the capacity to do a bunch of stretches and exercises, you know?
Right. I love how you're so in tune with your patients. You're like, I'm just going to, meet you where you're at, like you said, and I'm just going to support you wherever that place is.
Yeah.
You know,
I
and
just had someone recently was like, "Well, you didn't give me any stretches last time." And I was like, "I know."
you're like, that was on purpose.
Yeah. I was like, "We had other things that you needed to focus on, but
Yeah.
no."
Well, so I think I know the answer to this question, but I'm going to ask it anyways.
Sure, yeah.
Can chiropractic adjustments support better breastfeeding or improve like the posture while you're nursing, while reducing tension? Can it
Yeah.
suppress lactation?
I would say that it definitely can, or another way of phrasing it would be it's helpful to counteract the stresses of breastfeeding.
Uh-huh.
Um, that is very important. So we want you, of course, to find the most optimal, comfortable posture that you can when you're breastfeeding. But in the instances where that's just not doable, or baby only prefers one position or
Right.
something,
There's always a dominant side, right, too,
yeah,
when you're
yeah,
nursing.
your slacker boob versus your
Yes.
the
The
better
favorite
output one.
side versus
Yeah,
the not so favorite side. Yeah.
totally. Yes. And so we can definitely help support that. And it's not my specialty, but there are specialized chiropractors who have extra training in pediatrics as well. And so there is a whole education component to being able to get the right latch and get the right position and work between the mother and the baby to find optimal breastfeeding positions and just optimized breastfeeding in general. So if I have somebody who's expressing concerns with that or having some troubles, I'll often refer to a pediatric specialized chiropractor and have them work with that individual or with a lactation consultant. So my practice is most specifically just working on the moms, but
Mhm.
there are instances where that referral can be really helpful. So
Sure. That's incredible. I love that you're able to collaborate with other pediatric
yeah, an
chiros to help.
example like an example would be if your baby's preferring to latch on one side. That can be an indicator that there may be some tension within the baby's body, within their mouth, with their, oral function. And that would be an indication to seek out a pediatric chiropractor who's trained in the latch and breastfeeding related concerns.
That is so cool. I didn't even know that was a thing.
Yeah, yeah.
So good to know. I've learned so much from you. Even though we've been practicing together for several years, I'm just like in awe of all the benefits of chiropractic care and Webster technique. So I have one last question for you,
Sure.
Dr. Courtney. If you were to give advice to women that are pregnant or just recently delivered, what would be some of the words of wisdom that you would like to share with these women?
Mm. I would just say give yourself grace, truthfully. Be kind to yourself and find some people who can really support you during that period. Um, and have those people show up for you when you need them the most. And whether that may be someone that you expect to show up for you, that may be someone that unexpectedly comes into your life and is there to support you. Um, I just think like that would be the biggest thing that I would say.
Yeah, that's perfect. Don't
Yeah.
be afraid to ask for help.
Yeah. I mean, I've had instances where I've had a patient come in postpartum and they had a really traumatic birth experience, and we're talking through it obviously because clinically I have a lot of questions, what is it what can I help you with? What's out of my scope? What are we going to work on today? Um but I've also had them say like, that was really therapeutic for me, and that was really helpful to just be heard and be seen and to know that like this happens to other people, and people don't talk about it enough. And so just having like a safe space to share that I think is really special, and I think that everybody deserves that, especially in that early postpartum period.
For sure. Yeah, and thank you for providing that safe space for your
Yeah.
patients.
I mean, I feel like I feel honored to actually even be able to do that and to have people share with me. So
Mhm.
it's very special.
Yeah, definitely.
Mhm.
All right. Well, I can keep talking to you much longer, and I have so many questions, but I wanted to open it up to everybody else so that they can ask their questions if there was
Yeah,
anything that was left unanswered. So, if any of the guests have questions,
happy to answer any questions.
you can either come on or you can chat. You can also type it in the chat as well. Or did Dr. Hayes just like answer everything and more?
All
Okay.
right.
Well, I can't thank you again enough for joining us, everybody, and Dr. Hayes for being such a resource of knowledge for women in this phase of life, both in the pregnancy and postpartum phases. And yeah, I'm just so excited to continue to work with you. And now I have gained a better understanding of when to refer patients to you and how we can co-manage and co-treat.
Yeah, I'm excited. I love it. I
So
hope that we can shout this from the rooftops and not or destigmatize and not normalize pain during pregnancy.
yes, please. Amen to that.
Yeah.
Absolutely. And I think that should be one of the main takeaway messages of this entire talk is
Mhm.
low back pain is a non-option. Or pain. Pain is a non-option. You don't have to just live with it.
Yeah,
You
you
can seek
don't.
help for sure. Yeah. All right. Well, thank you, everybody. I wish you all a good evening. And we'll be releasing this as a podcast in a couple weeks. So stay tuned. If you missed some of it, or if you want to share this episode with your friends and family. All right. Thank
Thank
everybody. Have a good night.
you.